Well, Professor, welcome back and thank you for joining us.
Thanks for having me.
Look, last year you were very nuanced in your approach to both the Crossroads cluster, so-called, and the Northern Beaches outbreak. Is the current outbreak worse than Crossroads, which occurred during the depth of winter last year? Is it tracking to be more infectious, do you believe? What's your assessment of the level of response by the government? Is it proportional, or do you think they should be doing more, or do you think it's already an overreaction?
Well, I think what they're doing so far is proportional. And if we look at this so far, and winter is a good time to compare to outbreaks that are large, because winter it's so much easier to spread respiratory viruses. But so far, it's tracking the same way. The really important parameter we need to look at is not how many cases we're seeing, but how many cases we're seeing that we call mystery cases or unlinked. And there's very few of those. I almost get the impression from today's press conference, there's really only one, that child at a primary school. So I think so far they have been very successful at containing this by good contact tracing, good cooperation of the public. Now, whenever you have these outbreaks, you need some sort of restrictions, and it needs to be proportionate. But I don't actually think this warrants locking down, 5 million people at this stage. I think locking down or putting restrictions on a more limited number of people, which has been done before, look at the Northern Beaches, is more appropriate as we see how this unfolds. Perversely, you can actually look worse in some of these outbreaks now if you've got good contact tracing, because you find more positives earlier, because you're testing people earlier, even before they have symptoms. So it may look like, hey, this is going out of control, but in some ways you're just finding more cases. So providing we see the similar amount of cases only for the next few days, that there's not a number of mystery cases occurring or increasing number of mystery cases, then I think this is heading on the right trajectory to get this under control. And most of these clusters last 2 or 3 weeks. And then towards the end of that, the only people you really find is usually people who have already been in quarantine or isolation at home for at least a week. And they're the tail end of the incubation period. So people coming down at day 10, day 12, etc. So far, this is still worrying. But so far, it looks like this is, in my mind, a proportionate response to the amount of cases they're seeing, and particularly the low amount of mystery cases.
Indeed. And look, you made the very valid point that aerosol transmitted viral chest infections thrive in the winter environment because of people being indoors, more closely congested and so forth. You made that point last year when the Northern Beaches summer outbreak occurred, and you were much more sanguine about prospects. So far then, the stay-at-home orders would seem to be a nuanced approach and buy time to ensure contact tracing is working. Can you I know there's great curiosity and frustration amongst our audience. What's your view on the effectiveness of masks, Professor? There's a bit of blowback from the Sky audience about them being mandated. Do you think they work in these cases, or is it a symbolic gesture that achieves very little?
Well, I think masks do have a place for 2 reasons. First of all, if you're incubating the disease and you've got it, if you've got a cloth or a face mask on, when you cough or sneeze, it just goes less distance and there's less particles that transmit out there. How much protection it gives to you as well, I don't think we can answer that. The only study that was done in Denmark looking at protecting individuals from COVID, it gave you probably a 20% protection. That I might say is better than nothing. There's a study that came out today that looked at medical workers in the US and looked at antibodies. In other words, did they get infection? And interestingly, the medical workers had half the rate of infection of the community they were in. So it looks like masks do have a benefit. Interestingly, there's a debate about aerosols and droplets. My own view is most of the spread is by droplets. The advantage of that is surgical masks work, eye protection works, and it means you don't have to worry about going into a building an hour later because there still might be particles in the air. But not that you can't get it through very, very small particles, but the majority of transmission is when you're close to somebody, you're within a couple of metres of them, you haven't got a mask on, decreases your protection. So, look, the bottom line is masks aren't an answer by themselves. You need to do all the other things. Keep away from people who are sick, keep crowds down indoors, be outside rather than indoors, get vaccinated. But masks have an additional benefit indoors, both from protecting other people from you in case you've got it, but also giving you some protection from others in case you're near them and they may or may not have COVID.
Indeed. Now, as to the droplet transmission, thanks for that correction, as opposed to aerosol, I saw attributed to another epidemiologist an assertion that this thing can linger in the air for 16 hours after exhalation. Is that credible? Seriously?
Well, I don't
What
think
hope
it is.
have we got against that?
Yeah, basically, the people who are purporting aerosols, and there's quite a few, if aerosols are the main way this spreads, we're all had it. Basically, you can't go into a restaurant or a building even 5, 6 hours later because it's still in the air. You can be 20, 30 metres away and you can breathe it in. Surgical masks don't work. You've got to wear these respirators. Now, the reality is that's not what the data shows. Now, that's not to say that you can't get it by breathing in the air. And I think we've made a mistake with droplets. Droplets can go further than 2 metres. They can go 4 or 5 metres.
Yes.
I think that's what's happening in hotels when they're opening rooms across doors across corridors. And they can linger in the air for probably 5 minutes, but they don't linger in the air for 2 hours and they don't go 30 metres. And surgical masks and cloth masks give you some protection. So the vast majority of spread is when you're close up with people who are infected with them for any period of time. Can there be exceptions? Yes, there can. But we've got to look what works for the vast majority of cases. And if you use the droplet analogy rather than aerosols, what we do works. Not all the time, but it works the vast majority of time. And that's what we need from our public health intervention.
Understood. And look, the other controversial topic, of course, is the vaccination rollout. Now, there's been a lot of mixed messaging, not necessarily from medical professionals, but from the political class. Do you have any hesitation about the safety of the AstraZeneca jab? I've had one already, and I'm presuming you're under 50, Professor. You're looking very chipper, so I imagine you've probably had the Pfizer.
Well, I did have the Pfizer, and I had it last March because I work in a hospital that's a high risk, and we've got COVID samples in our lab. But that aside, and I am over 50, but I won't go into exactly my age. But anyway,
jolly good.
Look, my view is if you've had the first dose of the AstraZeneca vaccine, whatever age you are, and you haven't had a problem, I would have the second dose because it's a very effective vaccine. If you look in UK, the real world data, if you've had 2 doses of AstraZeneca or 2 doses of Pfizer, you get 90% plus protection against hospitalisation and probably 95% plus against death. And that's against even the Delta variant. So it works against all variants. Now, the reality is there is a side effect from the AstraZeneca vaccine, and it is more common the younger you are. And that's why they've had 50 and now 60 as their cutoff. It's grey, it's not black and white. But the reality is the vast majority of people who die from COVID, they're over the age of 70. The vaccine we've got means, yes, you've got a 1 in a million, 1 in 2 million chance of dying from the vaccine. But if you're over the age of 80 and you get COVID, you've got a 1 in 10 chance of dying of COVID. If you're over the age of 70, you've got a 2 in 100 chance of dying. The benefits from the vaccine so far outweigh the risk. And I think that was the problem with the media. The bad news is there because this does cause a problem, but we lose it in comparison to the great benefits. Now, if you're a 40-year-old or a 30-year-old and we can get hold of a vaccine that has got less side effects, well, even though it's really rare, yes, it's worthwhile you doing that. But the other reality is the only vaccine we've got in any quantity at the moment is the AstraZeneca. At least 2/3, thankfully, 2/3 of people over the age of 70 are vaccinated, but there's another third that aren't. And they need to go out and get vaccinated as soon as possible because if you ring your GP now, you'll be able to get an appointment. And yes, there's a risk, but the benefits so far outweigh the risk if we get spread. Please go and get vaccinated. The other reality is we've got about 300,000 doses of the Pfizer vaccine coming in per week. That is not enough to vaccinate everybody. But within a few months, we will have Pfizer, Moderna, and also another one called Novavax. So it is quite conceivable, I think, by October this year, that the vast majority of adults in Australia will have been able to and should have got their first dose of vaccine. And by the end of the year, we should have a large proportion of our adult population with 2 doses. We should be able to achieve 1 million doses a week of vaccination now. That could even increase as we get more supplies in a few months' time. So we do see an end to this, I would hasten to add, and that's through vaccination. And I think towards the end of this year, October, November, we'll be in a much better position than we are now.
Look, that's, I'm sure, been both informative and encouraging, Professor, to get some sense that there is a light at the end of the tunnel, I suspect is what most Australians are looking for at the moment, because for every person who's contracted this, I suspect there have been self-harms or others with just anxiety conditions and all kinds of other impacts psychologically and financially. So, Professor Peter Collignon, as always, an absolute pleasure. Thank you for taking time to speak to us this evening, and good luck with the side effects from the Pfizer jab.
Thank you.
All the best.